NCLEX RN Practice Questions 2026 to boost confidence before exam day. Question 1. An infant holds his head in an unusual position and always faces to one side. What is the most likely explanation? Option A. Torticollis. Option B. Craniosynostosis. Option C. Plagiocephaly. Option D. Hydrocephalus. The correct answer is option A. Torticollis. Torticollis, Rhineck, is caused by the shortening or contraction of the sternocleidomastoid muscle, causing the head to tilt. Question 2. Which statement about Osgood-Schlatter disease is correct? Option A. Caused by competitive swimming. Option B. Usually requires surgical intervention. Option C. Patient experiences pain in the inferior aspect of the knee. Option D. Student is trying to avoid physical education. The correct answer is option C. Patient experiences pain in the inferior aspect of the knee. Osgood-Schlatter is an overuse injury causing pain and swelling at the tibial tubercle, just below the kneecap. Question 3. A nurse asks a 13-year-old female to bend forward at the waist with arms hanging freely. Which assessment is being conducted? Option A. Spinal flexibility. Option B. Leg length disparity. Option C. Hypostatic blood pressure. Option D. Scoliosis. The correct answer is option D. Scoliosis. The Adams forward bend test is the standard screening tool used to detect the spinal curvature or rib hump associated with scoliosis. Question 4. Which characteristic is the nurse least likely to find in a parent who is abusing their child? Option A. Low self-esteem. Option B. Unemployment. Option C. Self-blame for the injury. Option D. Single status. The correct answer is option C. Self-blame for the injury. Abusing parents often use denial or project blame onto the child. They rarely exhibit genuine self-blame or insight into the injury. Question 5. Which sign or symptom in a 4-year-old child following head trauma would be a cause for concern regarding increased ICP? Option A. Bulging anterior fontanelle. Option B. Repeated vomiting. Option C. Signs of sleepiness at 10 p.m. Option D. Inability to read short words from 18 inches. The correct answer is option B. Repeated vomiting. In a 4-year-old, whose fontanelles are closed, repeated vomiting is a classic sign of increased intracranial pressure. Question 6. Which observation indicates that a non-immunized child may have rubella, measles? Option A. Small blue-white spots visible on the oral mucosa. Option B. The rash begins on the trunk and spreads outward. Option C. There is low-grade fever. Option D. Lesions have a teardrop on a rose petal appearance. The correct answer is option A. Small blue-white spots visible on the oral mucosa. Colix spots, small blue-white spots on the inner cheeks, are a pathognomonic early sign of rubella. Question 7. Which description of scarlet fever is not correct? Option A. Caused by group A streptococcus. Option B. A strawberry tongue is a characteristic sign. Option C. Petechiae occur on the soft palate. Option D. The pharynx is red and swollen. The correct answer is option C. Petechiae occur on the soft palate. While strep can cause petechiae, they are not a defining characteristic of scarlet fever as much as the sandpaper rash and strawberry tongue are. Question 8. A 30 kg child is prescribed Benadryl 25 mg 3x/day. The correct dose is 5 mg/kg/day. Which describes this dose? Option A. It is the correct dose. Option B. The dose is too low. Option C. The dose is too high. Option D. The dose should be increased or decreased depending on symptoms. The correct answer is option B. The dose is too low. Calculation: 30 kg * 5 mg equals 150 mg per day. The current order, 25 mg * 3, is 75 mg per day, which is half of the recommended dose. Question 9. Regarding an undescended testis in a 2-month-old, which statement is most accurate? Option A. Normally, the testes are descended by birth. Option B. The infant will likely require surgical intervention. Option C. The infant probably has only one testis. Option D. Anormally, the testes descend by 1 year of age. The correct answer is option A. Normally, the testes are descended by birth. In most full-term infants, the testes have already descended into the scrotal sac by the time of birth.